Welcome to part 3 of our COVID Conversations video series. For this last video, we will be discussing considerations for getting tested for COVID 19, as well as some takeaways for our whole video series. So, per the Centers for Disease Control and Prevention, people who need to get tested for COVID 19 include people who have symptoms of COVID 19, people who have had close contact with someone with confirmed COVID 19, and people who have been asked or referred to get tested by their healthcare provider and or local or state health department. Remember that not everyone needs to be tested. If you do get tested, you need to self-quarantine or isolate at home pending your test results and follow the advice of your healthcare provider or a public health professional in the meantime. So, it's important to know where you can get tested locally for COVID 19. First, I recommend that you speak with your campus student health center to see if they are providing COVID 19 testing to students. If they are not providing COVID 19 testing to students, or you don't meet the requirement, or perhaps you're not able to get tested in a timely fashion, then I recommend that you go to the Virginia Department of Health COVID 19 testing site's webpage. I have an example here on the right, and all you have to do is just put in your location, your search radius, and it will end up listing locations that are close by that provide COVID 19 testing. It also provides their contact information and any of their criteria for getting tested. You can also always make an appointment at a Central Shenandoah Health District community testing event. Now, these events are usually, like I said, appointment only, and they're only for people who are exhibiting symptoms of COVID 19 or are close contacts of a known COVID 19 case. And if you end up getting an appointment at one of these testing events, it is important that you do show up for the appointment and get tested. You can follow the Central Shenandoah Health District Facebook page to find out about our local testing events that we hold locally. Here are some considerations for getting tested for COVID 19. First, it is important to realize that if you get tested outside of your student health center, say you get tested at an urgent care, then the health department will have your access to your lab result regardless. But your student health center will not have access to your result because they were not the ones to administer the test. So they will not know if you test positive or negative. And because the health department cannot share your results, which are considered to be private health information protected under HIPAA, so we can't share your results with the university, and not just only the university, but anyone. So whether it's your employer, your friends, any organization that you're a part of, we cannot tell people that you tested positive unless you give us consent to do so. If you do not give us consent, all we can do at the end of the day is to notify your college the number of new cases for that day. But that is it. We can't let them know that you tested positive. So this is important because it means you need to self-report if you test positive. Remember, of course, that you cannot test out of quarantine. You have to finish that full 14-day period of quarantine from the last day that you were exposed, even if you test negative during that period of time. There is more information about quarantine in part 2 of our series. So you're also going to need to self-isolate until you receive your test results. This is important because if you happen to be contagious during this time and you are hanging out with your friends, then you are not only exposing them to the virus while you are waiting for your result, but also they will now have to go into a 14-day quarantine period if you test positive. It is also possible that you could test too early after an exposure, which could result in a false negative. So it is best to get tested 5 to 7 days after an exposure to COVID 19, or 5 to 7 days after you start to develop symptoms if your symptoms are mild. Of course, you still need to quarantine and isolate immediately if you were exposed to COVID 19 or if you start to exhibit symptoms. Don't wait to quarantine or isolate until you get your test. And lastly, if there's anything that you take away from this video series, then this is it. Please use your local address of where you live while at school on your testing forms. So, say you live in Virginia Beach. If you get tested at the local urgent care where your school is and you use your Virginia Beach address, Then when your test result is sent to the health department, it will get sent to the address that you listed or get sent to the health department of the address that you listed. So it will get sent to the Virginia Beach Health Department in this instance, not your local health department in the Central Shenandoah Health District. And this can slow up our case investigation, especially if you live out of state. Because if you test positive and it gets sent to your health department for your home address, then your result will take some time to get to the Central Shenandoah Health District. And this would just slow up the case investigation and impact effective contact tracing. So please, if you get tested at a local practice while at school, use your address that you live at while at school on your testing form. So I want to end our presentation today with what you can do to help your community, kind of like the takeaways from this whole presentation. So for my students and my campus leaders, please be brave. Being transparent about your contacts will help reduce the spread of COVID-19 amongst our community. I know that it's hard, and I know that sometimes we might be fearful of getting in trouble if we were fully transparent about what we were doing, who we were around, where we were when we might have been contagious, especially if we were engaging in riskier behaviors. But please be rest assured that you will not get in trouble if you were engaging in riskier behaviors. Really, it's an act of compassion and an act of heroism if you're able to be honest and transparent with our case investigators about who you might have exposed while you were contagious. Be connected. Download the COVID Wise app. Use Sarah Alerts if you are a close contact and use it correctly every day. Follow the Central Shenandoah Health District Facebook page for up-to-date news on new testing events in your area. Be smart. Reduce your risk of exposure, follow public health guidance, wear a mask, social distance as much as you can, stay home as much as you can as well. We all know what we should be doing right now. It's not new to us what we need to do to reduce the spread of COVID-19. I know that it's been a really tough time for most of us throughout the past couple of months, and we've had to change our social um, fabric of our society over the past couple of months. But if we're going to be able to get through this together, we all need to do our part. Finally, be a leader. Normalize proper quarantine measures and isolation measures. Normalize infection prevention measures amongst your friends, like wearing a mask and social distancing, and deciding to not go to social gatherings that are large and might increase your risk of exposure to COVID-19. If we can normalize following through with the 14-day quarantine or following through with our isolation or even using Sarah alerts correctly, then I think that we might be able to really make an impact amongst our friends and our peer groups and help reduce the spread of COVID-19. For administration, teachers, and support staff, encourage connection amongst your students. Encourage them to use COVID-Wise, to actively use Sarah alerts if they are a close contact, and to follow the Central Shenandoah Health District's Facebook page. Encourage proper information. Do not spread misinformation. If you do not know an answer to a question, then it's okay to say I don't know and then follow up with the proper public health guidance. It's available on the Centers for Disease Control website or the Virginia Department of Health website. Be a role model. Wear your mask, follow social distancing guidelines, encourage your students to do the same and encourage them to actively participate in these public health guidances. And finally, be compassionate. Pointing fingers does not solve any issues we might have in regards to reducing the spread of COVID amongst our community. If we're able to be compassionate instead and help empower our students and our community to do the right thing, then perhaps we might be able to reduce the spread a little bit faster. Finally, how can we support you? I encourage you all to reach out to the Central Shenandoah Health District if you have any questions or concerns about COVID-19 or what you need to do to quarantine properly or isolate properly. And our contact information is on the next slide. And that is the end of the part 3 video for our COVID Conversations educational video series on COVID-19. Thank you so much for watching. If you have any questions, please feel free to reach out at cshdinfo@vdh.virginia.gov. You can also always call us at 540-332-7830. Please also follow us on Facebook for more information about COVID-19 and to also stay up to date about any local testing sites in your area. And of course, you can always call the Virginia Department of Health COVID-19 call center hotline at 877-275-8348. Thank you again for hanging in there with me. I appreciate you guys taking the time to empower yourselves with information on how to stop the spread of COVID-19 within our community. Stay well, protect each other, and I hope you have a great rest of your day.